Hello, guys, and welcome to another episode of the HIV and AIDS, that is the cure for your HIV. I remain Maria Moses, and as we all know, I'm a lady very passionate about the health and well-being of people, especially people living with HIV and AIDS, and general population as well. Okay, so if you are looking for the latest on HIV and AIDS, you want to access to care and treatment, or perhaps you want some advices or counseling with regards to relationship, you are in the right channel. So I am a public health practitioner, and I work to support change so that people around me and people around the world can have certain knowledge to make informed decisions or choices about their sexual health and general healthy lifestyle. This is in the support of the global efforts to end disease and pandemic and HIV worldwide. So guys, if you like my channel or if you like my videos, kindly give me a thumbs up. Also, you can click on the notification bell so that you get the latest update. And don't forget to subscribe to my YouTube channel, and you can as well share to your loved ones so that they can be in the loop of what is going on in the world at large, especially with regards to HIV and AIDS. So today, guys, today I have something very important to talk about, and that's going to be I'll be talking about HIV and AIDS in pregnant women and infants, and also the HIV and AIDS complications in pregnant women. In my last episode, I actually talk about brief things on HIV and pregnancy, and however, today we'll still continue from where I stopped. So today, we have different types of pregnancy complication. Normally, we have gestational disease or diabetes. We have hysteresis. And then we have toxoplasmosis. We have ectopic pregnancy. We have placenta previa, and we have mastitis. We have urinary tract infections and placenta abortions, preeclampsia. We have preterm labor, and so on and so forth. So these are the major complications women normally encounter during pregnancy. However, talking about HIV and AIDS in pregnancy, human immunodeficiency virus is a virus that causes that causes AIDS. Okay, and when a person becomes infected with HIV, the virus attacks and then weakens the immune system. Now, as the immune system gets weakened, the person is at risk of getting life-threatening infections, and such as there are a lot of them. Cancer is also part, and when that happens, the illness is actually called AIDS. So HIV can be transmitted to the fetus or to newborn during pregnancy and during labor, during delivery, or by breastfeeding. So today we are actually talking about HIV and pregnancy complication. So a pregnancy in an HIV infected woman is considered a high risk pregnancy. Okay, so national guidelines for the care of HIV infected women recommends that an intensified prenatal care for women, okay, including referrals for prenatal ultrasound screening too. And if a fetal anomaly is suspected, okay, invasive prenatal testing can be offered after being on HAART. Now, which happens to suppress the viral load below the limits of detection. So in these cases, present evidence suggests that the mother-to-child transmission is not higher than 1%, which is the known rate for transmission in optimal setting. Okay, so when a woman is actually taking her antiretroviral the way she ought to be to take it, the way it's expected of her, then it is expected that the viral load level in the blood is as reduced to what we call targeted not detected, that is the TND. That is, you can't detect the virus again in the blood, so they are almost near negative. Okay, so this antiretroviral, which is the HAART, is given during pregnancy for two reasons. First, it is given to women requiring treatment for their own health, and secondly, it is given to pregnant women starting therapy purely as a prophylactic treatment to reduce mother-to-child transmission of HIV and AIDS, which is the MTCT. So that's that about that. However, in pregnant women with HIV, some of these complications I just mentioned earlier can surface if care is not taken. Okay, if care is not taken. Now, national treatment policy changed several times within the study period. Okay, so the major changes were we have like I said, if the viral load was undetectable, it is recommended that a vaginal birth should be offered, and if a cesarean delivery is chosen, then delivery should be delayed beyond 38 weeks. And then another thing is that the recommendation of initiation of HAART in treatment native pregnant women changed from 32 weeks of gestation to 28 weeks of gestation in singleton pregnancies to achieve complete viral load suppression at the time of delivery. So we also have another policy, which is the new HAART regimen option, actually with has better efficacy and possibly it offers overall improvement in maternal health and is therefore approved for use. Okay, so if you know that you are positive with HIV, please do not forget that you need to take your antenatal very serious. Immediately report yourself in the hospital so that you can be given the right treatment. Okay, all right. So postpartum complications are also challenges in women, and like I said, the postnatal course will be complicated, and no special medical care will be needed. So if you are an HIV positive person, you need to be very, very careful, because your immune system is now can be subjected to different kinds of infections. That's what it means. So there are several kinds of infection, like what I've mentioned. Pneumonia is part of it, fever is part of it, tuberculosis is part of it. Unusual infections can even come. Why? Because the immune system is actually down. So effects of HIV on pregnancy. Pregnancy related complications for women with HIV include high increased risk of spontaneous abortion, and of course there could be double there's also increased risk of having LBW infants, and which is low body weight infants, and then increased risk of stillbirths are also common with people with HIV and AIDS. And then there are increased risks of bacterial pneumonia, urinary tract, and other postnatal infections can be found in women with HIV and AIDS infections if you are not taking the proper care, or if you do not adhere to your doctor's instructions. So lower fertility due to ovulation abnormalities, weakened immunity, and stress or side effect of HIV and AIDS drugs. When you don't take your drugs effectively, when you have an HIV person who is intending to become pregnant, can have some of these complications, because the fertility level can drop. Why? Because I told us the HIV itself lowers the immune system of the body. So if the immune system of the body is not working effectively, other things are also likely not to work effectively in the body. Okay, so an HIV positive mother can, like I said, transmit HIV to her baby anytime during pregnancy. It can be during childbirth as well. It can be during breastfeeding. So if you are a woman with HIV and you are pregnant, treatment with a combination of HIV medicine called the antiretroviral therapy or ART can prevent transmission of this HIV to your baby and also protect your health. This is very, very important. It is very, very, very important and key for you to consider and take note. Okay, so how can you prevent HIV transmission to your baby? Okay, there are several steps you can take to reduce your risk of transmitting HIV to your baby. Okay, 1, get tested for HIV as soon as possible. Get tested for HIV as soon as what possible. Okay, and then if you have HIV, the sooner you start treatment, the better. Okay, so for your health and your baby's health, and to prevent transmitting to even your partner. All right, so another thing is that if you don't have HIV but you or your partner engage in behaviors that put you at risk for HIV, get tested again in your 3rd trimester. Okay, and then you should also encourage your partner to get tested for HIV as well, so that both of you can be on a safer side. Okay, so that's that about that. So guys, I'll be wrapping up here, and I believe that you have learned something very important. This means that if you are HIV positive person and you are pregnant, or you want to become pregnant, you want to conceive and have a baby, it means you need to take your health very serious. If you want to conceive, probably one of your partner is positive and probably you are positive and your partner is negative, or reverse, or vice versa. What you need to do is this: get your adherence counselor or your doctor in the knowing. Inform your doctor or your adherence counselor so that they can have the knowledge. So why are you doing this? This is because they will counsel you and tell you how to go about it in a way that you or your baby will not be infected, and again in a way whereby you will not transmit this HIV to your partner. Okay, all right. So, and if the both of you are positive, then it's also very important for you to carry your doctor along and your adherence counselors, so that they can educate you and teach you and give you some guidelines on how to prevent your child from becoming HIV positive. So guys, thank you for watching, thank you for listening, and I'll see you again in my next episode. Please, if you like my video, kindly give me a thumbs up, like my video, and also don't forget to subscribe to my YouTube channel, and also please share this video, share this link to your friends and loved ones, so that they can also be part of this great educative studies, or they can be in the loop. So finally, let's join hands together and to fight HIV and AIDS in our world. Thank you for listening, and see you in my next episode. Bye.